Muy buenas tardes y bienvenidos to our webinar on building upon the resilience of Hispanic families during COVID-19. I'm Maria Ramos-Olazagasti, the Building Capacity Lead for the National Research Center on Hispanic Children and Families, and I'm very excited to be facilitating this webinar today. Before we begin, I'd like to go over some logistics. To make sure that the audio is clear, we've muted all participants for the duration of the webinar. However, you can type in questions for panelists in the question box. We're going to be monitoring these throughout the webinar and try to answer as many of these as possible, either by answering the chat box or by bringing these up during the Q&A section of the webinar. Finally, the webinar will be recorded and available on our website later next week, so please be on the lookout for that and share with your networks if you like what you hear today. We'll also be live tweeting, and if you, again, like what you're hearing today, please share it on Twitter, and when you do so, we ask that you use the hashtag NRCHComunidad and our Twitter handle at NRCHispanic in your tweet to help us retweet, follow you, and also build connections in our network. An important note that the views expressed in this presentation do not necessarily reflect the views of our funder, the Office of Planning, Research and Evaluation, the Administration for Children and Families, or the U.S. Department of Health and Human Services. And with that, we're ready to begin today's webinar. So I'll start by acknowledging that the pandemic has really affected us all here, one way or another. But you probably have seen in the news or recent research that Hispanic families have been particularly badly hit by the pandemic. In fact, a report that was released just 2 weeks ago by Pew indicated that half of Hispanic adults have a family member or close friend who was hospitalized or died from COVID-19. Also, about half of Latinos said that they or someone in their household lost their jobs or received a pay cut during the pandemic, which of course, both of these stressors can put a lot of strain in relationships and families and children as well. However, there's a reason to be optimistic about the future of Latino families. A lot of research has shown that Latinos bring a lot of strengths that can help them cope with some of these stressors. For example, research from the Hispanic Center has indicated that many Latino children in low-income households live in two-parent families, especially those from immigrant families. Also, that Latino mothers are likely to experience stable family life during their children's early years, and most mothers of young children report low levels of co-parenting conflict, or the arguments that can come up between couples as they discuss how to raise their children. Lastly, Hispanic families also have very strong family bonds. For example, Hispanic fathers who live with their children are frequently involved in their children's lives. They share meals together, they show love and affection, and they spend time with their kids. So all of these features or characteristics give us hope that Hispanic families have the key ingredients to thrive despite of the challenges that they're facing. And in fact, the same Pew study that I referred to earlier indicates that a year into the pandemic, Hispanic adults say that they're optimistic about the future. And this is quite remarkable given the high level of adversity that they've endured for such a long time. And this is precisely what we want to focus on today, the resilience of Hispanic families in the face of adversity. Because Hispanics are not just experiencing challenges, they're also showing a lot of strength during this difficult time. So the goal of this webinar is twofold: to present recent research on protective factors among Hispanic families facing COVID-related stressors, and to talk about where to go from here. So we'll discuss how programs can leverage the strengths of Hispanic families to support them now and in the future as they recover from the pandemic. Our panelists today all have worked or do work still with Hispanic families, either through research or by providing direct services. And they've seen great resilience in their families. Dr. Natasha Cabrera, our first presenter, is a co-investigator of the National Research Center on Hispanic Children and Families, and she's a professor at the University of Maryland's Department of Human Development and Quantitative Methodology. She's joined by Adrián Pedrosa, who is the Director of Strategic Partnership at Abriendo Puertas, or Opening Doors, a national parent leadership training program focused on supporting Latino parents with young children in their quest to ensure early school success and overall child well-being. And last but not least, Mariana Osoria is the Senior Vice President of Partnerships and Engagement at Family Focus, which is a family support organization in Illinois, whose mission is to invest in strengthening families and their children by building social capital to achieve upward economic mobility. We're going to start by hearing from Natasha's recent work, Family Functioning in the Time of COVID-19 Among Economically Vulnerable Families, where she looked at COVID-related stressors among Hispanic families and factors that protected families from the negative effect of some of these stressors on families and children. And we'll see that her findings are very much aligned with the optimistic picture that we saw in the Pew study that I referred to earlier. So I'm going to turn it over to Natasha so she can share her study.
Great. Thank you, Maria. Good afternoon, everyone. I'm delighted to be here. So as you just heard, Hispanic families have been hit quite hard by the pandemic, and that's also what we found in our study. We found that not only have parents experienced a lot of economic stress due to job loss or inability to pay the bills, but they also experience what we call social stressors. And by this we mean, being exposed to the virus either themselves or someone they knew, as well as having had their childcare arrangements completely disrupted. So we know from research that these economic and social stressors can take a big toll on family functioning. That includes parents, but also children. So parents' mental health about losing a job or getting sick was severely affected, as well as children who woke up one day and their routines in their little lives changed forever. So we believe that these stressors are a major source of maladaptation for parents and for kids. However, you also heard from Maria that many Latinx families have a lot of strengths that, such as strong families and a hope for the future, that can help them withstand a lot of adversity. So although we know about these strengths, we don't really know whether they are enough to protect parents from disasters like the pandemic. In this study, we wanted to know how economic and social stressors brought about by the pandemic have affected the family functioning of our families. That includes mental health and parenting, as well as we wanted to see how children were doing during this time. But in addition to the stressors, we also want to get a really clear idea of what parents are doing to help themselves to get through these difficult times. So specifically, we had two goals for this study. The one goal was to examine the kind of stressors that were common in our sample of low-income parents of young children, and to find out how these stressors were affecting their mental health, as well as the quality of the parenting behaviors, such as spending time with children, playing, or even keeping up with their routines. We were particularly interested in learning how parents perceived the children's behavior during this time. Did they see more behavior problems? Did they see that the children were adapting to the new normal? The second goal of our study was to really understand how parents coped with these stressors. How do they lean on strengths of their families? We focus on two particular strengths because we know from other findings, other research, that these are particularly helpful for families. One of them is co-parenting support. That is how parents are working together to parent a child. And the other one is, the other protective factor is positivity. Parents' optimism for the future. Can you keep positive in light of adversity? Next slide, please. So it's useful when we were doing this research to think of an umbrella in the rain as a metaphor. So when it rains, we use an umbrella to protect us from the rain. And in terms of ordinary rain, the umbrella works quite well, right? We don't get wet. But when the rain turns into a hurricane or a storm, the umbrella becomes useless almost, doesn't protect you. So in our study, we wanted to know what were the umbrella that protected parents against different types of stressors. Were the strengths good enough to protect them from the harm that the stressors can have on themselves and their children? Next slide, please. So let me start by telling you a little bit about our sample. the parents of the families who participated in our study, are already participating in a previous study, intervention study of mothers and fathers that aims to provide child development knowledge to parents. Things like, what do you do when your child to promote reading or literacy or language development? For the present study, we interviewed about 250 Latino first-time moms and dads who were living together or cohabiting at the time of the interview. Their children were between 22 months and 55 months, so 2 and 4.5 years of age. All the parents were low income and they lived in the DC area or in California, Orange County. It's also worth noting that when we made these phone calls to parents, this was last June and July. So this was right 6 months into the pandemic. So you can imagine that things got a lot worse from that time on. So just to keep that time frame in mind. Next, please. Okay, so this is just a visual to show you that most of our families, 64% of them, reported having some type of economic stressor, like they lost their jobs or they were really having a hard time paying their bills. Only 36% said that they didn't have any economic stressors. Next slide, please. This one's also gives you a clear picture that most of our families, 53%, felt the social stressors. That is, they knew someone that had COVID or they were exposed to COVID themselves. They were afraid to get it, and also had major disruptions to the childcare arrangements. So parents were at home feeling scared and stressed, and the children were also at home with them. Next slide, please. This one is really quite stunning, I think. What you can see here is that the majority of parents, 90%, almost all of them, say that their children were also struggling to deal with all these changes. And this is not surprising in a way that, if adults can't handle such pandemic type related stresses, then it was really hard for kids. But it was surprising to see that almost all parents said, my children are also having difficulty with this time. Thank you. Next slide. Okay, so what did we find? So we were interested in learning how the stressors had particular impact on different aspects of family life. And what we found was that the stressors that parents reported to us, they affected many aspects of family functioning. They affected the mental health, the way they interacted with the children, and how they perceived the children's behavior at home. So more specifically, parents who reported experiencing a lot of economic stressors, like they lost a job or they really couldn't pay their bills, also reported a lot more symptoms of anxiety, depression, and stress. But in contrast, parents who experienced more social stressors, so they were exposed to COVID or they knew someone who did, or they couldn't go to work because of someone got sick, and they didn't have childcare arrangements, those parents actually reported that their relationship with the children was suffering. It wasn't as of high quality as it was before. They found themselves not playing as much with the children, not reading as much, and even they couldn't keep up with the children's routines at home. So the pandemic really affected the way they were organizing the environment for the children at home. Also, and a little concerning to us, the same parents also reported that the children were angry more often. They were having temper tantrums and, had difficulty time controlling their emotions. And these things are concerning because children who are a little difficult tend to be parented more negatively. So we wanted to keep an eye on that. Thank you. Next. Okay, so amidst all these challenges, there's some hope, as Maria reported early. Optimism, it's also what we found. We found that despite all these stressors, incredibly for so long and so rapidly in these families' lives, we also found that in a way they were using their umbrella, so to speak, to get through the pandemic. What I mean by that is that co-parenting support, parents being on the same page about the child, not arguing, not undermining each other, but helping each other, and staying hopeful, keeping an eye on the future, that things are going to get better. Those parents, that was sort of the umbrella for these parents. It protected them from feeling really depressed and anxious, and they were more likely to see good things in the children. So parents who reported economic stress had better outcomes for themselves and their children only when they felt supported by their partners and they felt that this was going to end at some point. However, it's really important to point out as well that we found that this umbrella was really offered no protection against all stressors. So in particular, parents who felt a lot of social stress could not be protected or did not feel protected by co-parenting supporting optimism. So in essence, we really need to find out how these different types of stressors are affecting family life and in what way. And this is important for interventions when you really to understand how, for example, if you lost your partner or your mom or your dad and you couldn't be at the bedside, you at the deathbed, you feel like horrible. This trauma and loss that you feel is not easily addressed until you process how this happens. So these families need both type of support, economic and social. Thank you. And this is just a visual to give you a sense that the risk factors, the clouds in this picture and the protective factors act in unison. But the main point is that not all protective factors are good enough against all sorts of risk factors or stressors.
I'm sorry. Thank you, Natasha, for sharing your findings from the research. So what we're hearing is that despite the challenges that families are facing, they did show a lot of positive outcomes when they kept a positive outlook and when their co-parents were supportive. I'm interested in hearing now from Adriana and Mariana about their thoughts or their experiences working with families on the ground, and if these findings resonate with what they with what you saw with working with families. I know that you both conducted surveys with your clients, and I'm hoping that you can share some of those results, both in terms of challenges and how they managed to cope with the challenges that they were experiencing. I'm going to start with you, Adriana, if you don't mind.
Yes, thank you, Maria, and thank you, Natasha, for sharing those findings. Abriendo Puertas, Opening Doors, together with Latino Decisions, interviewed 1,200 Latinx families across the country, right as we were closing schools and kind of getting into the pandemic almost a year ago. What we found were much of what Natasha shared, that the families were feeling an immense stress, uncertainty, economic pressures, on how, because of the pandemic, and also in addition, as families, parents were faced with having to all of a sudden be maybe that primary teacher at home or support that learning at home. So families were feeling an immense amount of stress, as we heard. We did hear from many families, like a mother, Ophelia in Florida, that shared with us that it was real important that they had an ability to be able to both work and support their children at home, right? As families were thrown into the situation where they were all of a sudden having to make sure that their families had all the essential needs, but also support the child learning at home. That it was very important, right? And for example, in Ophelia's case, that her husband was able to continue working as an agricultural worker, as an essential worker, while she was able to both work from home in the childcare, supporting childcare centers, as well as supporting her children. And although she talked to us about the immense amount of anxiety and stress, right, all of a sudden having to deal with this, that she felt better that they were able to still manage financially by being able to have sort of this division of labor, right, being able to co-parent in a way that both supported their economic needs as well as the learning and emotional needs of their families. And this we heard, from story after story from families across the country, that at a most urgent, at a most pressing and dire time, that families really needed that additional support, either from another co-parent or even from families and friends, right? We heard from our survey that 1 in 3 families were actually even borrowing money from friends and family. So that social capital that families so desperately needed really was essential during this period of the pandemic.
Great, thank you. Mariana, can you share some of what you saw with your families?
Absolutely. Thank you. Glad to be here. I think the findings are absolutely resonating with the experiences that we had at Family Focus. As you mentioned, we also did a survey. We did a survey of over 400 of our participants here in Illinois, and our results were very much in line with the current larger studies that you've mentioned. We found that in terms of families that have been impacted by COVID, in particular, the issues that they have been facing having to do with income access, so that is losing jobs, reduction in hours, inability to find additional jobs, being impacted by COVID, that is, as mentioned, either getting sick themselves or having a family member get sick and in many cases even die from COVID. Social, emotional, and mental health issues were presented in a number of ways for families, with increased levels of isolation and anxiety being a couple of the items that families reported, and an increased need in mental health or behavioral health services was needed. Additionally, we found that in our survey, we found that about 69% of the participants actually had a positive outlook in terms of things or thinking that things were turning around and that the situation would improve as we move forward. This was especially true for those that were optimistic about the vaccine's efficacy. And so, similar to what Adrián said, we have an interesting story of positive co-parenting that impacted our families. One family in particular that we think we had a really incredible testament of positive co-parenting, even though this is not a traditional cohabiting couple. This was a couple that is no longer in a romantic relationship, and we have been working directly with the mom on this case. And early on in the pandemic, she lost her job, like many people did. She worked diligently to try to find alternate income. She was also impacted by losing her childcare services and having her school-age children be at home during the school day. And although the father of the children no longer lived at home, they both together realized that she was going to have a lot of trouble finding another job and the added challenge of caring for children at home. They worked together, and he decided to increase his economic support to his family, as he had not lost his job, and truly work together to focus on the children. So together, they really wanted to say, we're going to work together to support our children. And although they realized romantically they could not be a partnership, that they were still a partnership for their children. And so they focused on those children. So dad was able to help pay rent. He was able to support the family at a higher level. This also included supporting and transportation to and from medical appointments for one of the children that had a medical condition that required frequent medical visits. This family is currently thriving, and mom has even reported a more positive relationship with father, in particular in his relationship with his children. So we have seen, in action, families that are making it, really working towards the benefit of their own family, and that they're kind of keeping their eye on that prize, which are the children.
Thank you. That's great to hear that this positive co-parenting is not only happening within intact couples, right, but also couples that are no longer together. And can you say a little bit about where you see this positivity coming from? Because it's hard to stay positive, right, when there's a lot of challenges coming your way. So where do you both see that this positivity is coming from for these families?
Yeah, as you said, Maria, it's in the most difficult time, right? It's hard to really to stay positive. But I think what we were hearing from parents and families is really having that social support, right? Having people to be able to talk about these challenges with, right? Whether it's a partner at home, or a neighbor, or comadre down the street, or a vecino. I mean, it was really important, right, that parents during this time had people to be able to talk with, right? In fact, at Abriendo Puertas, Opening Doors, we work hard to really create these communities of parents, of peers, where parents can share all the challenges. And this is, before pandemic, during pandemic, and it's true after, that we as parents, many times need, to be able to talk about all these different, challenges and all the positive things that come with parenting. And during the pandemic, was of course that need was elevated. And so At Abriendo Puertas, Open Doors, we work to really talk about the importance of positivity. And we do it through kind of sharing 3 different characters. So in our curriculum, we have Norma Negativa, Mario Mañana, and Patricia Positiva. And these characters are meant to really help parents and families to kind of unpack all these different dynamics and personalities and feelings that we feel as parents during everyday life, especially true during the pandemic when we were, very much, tied in a household, right? And experiencing all these different emotions, but being able to really reflect on how we interact in our household with other adults, but also especially with our children. And so we have a little clip here, I think, of kind of these 3 characters and how we work with families and helping to understand how these feelings impact the way we interact with others and our children.
Okay, I'm going to share now.
Go for it.
Sometimes we approach new situations positively, other times we procrastinate, and sometimes we are negative and resistant to change. Parents who participated in the Abriendo Puertas program developed these 3 characters that represent these attitudes. These 3 characters are part of the Abriendo Puertas curriculum, and you will get to know them in the different sessions. Let's take a moment to meet our 3 characters. Positive Patricia has a very positive outlook on what she's learning in the Abriendo Puertas Opening Doors program. She's open to new ideas and encourages those around her. Thomas Tomorrow likes to put things off for later. He has a "it can all wait" attitude. The negative Norma has a negative outlook about what she is learning. What you will be seeing in this skit is each character's perspective before experiencing and completing the entire Abriendo Puertas Opening Doors program.
So as you saw, these 3 characters kind of help through drama, through theater. These 3 characters kind of play out throughout the Abriendo Puertas curriculum, but it really helps us as parents to really just reflect on how we might be feeling that day, how our emotions and our behavior might be impacting others around us. And in no way are we saying that, any one of us are always Patricia Positiva or Norma Negativa or Maria Mañana. It really is understanding how these different emotions and how we interact really impact, especially our children, and impact the stress level, right, in our homes. And during this pandemic, it was especially important for us, and as we heard from Natasha, to really understand where we were at and where our emotional needs, right, whether or not they were being met. In our survey, we showed that 60% of parents were saying that they needed some kind of emotional support, and it's real important, right, that we continue providing that support, not just now during the pandemic, but especially now as we look toward our recovery and towards returning back to school and all the different stress that we're all still feeling as families.
Great, thank you for sharing that. It becomes very clear, and I think we've all seen this even in our lives, that the emotional support's really needed there because this is just being a lot. And I find very interesting that Abriendo Puertas is using this positivity framework to inform programming, because sometimes we think of positivity or optimism and pessimism as a personality trait, or that, there's positive people, there's negative people, but this is something that you can teach and you can foster through programming and through opportunities that we provide clients that we serve. So it's great to hear that Abriendo Puertas is actively doing so. Mariana, do you want to share something about how you think families that you serve have stayed positive and how you think the program is helping support that?
Yes, I want to thank Adrián for sharing what Abriendo Puertas is doing, and I think we certainly agree that there are benefits in terms of having social supports. Well, we do that at Family Focus. That's a key piece of the work that we do. But I also think that there are elements of a person's or our community's history and experience that supports them in having this positive outlook. And, in particular, not internalizing the situation that's happening externally, right? Recognizing that this is a pandemic. I'm not in this situation because of something I did. This is something that's happening across the country. And I think about a particular family or a mom who we've been working with recently that had one child of her own, and a male family member who had 3 teenagers sadly died, and she got custody of these 3 teenagers. This is a mom who was not necessarily computer savvy, was certainly low income. She now had DCFS involvement in her life because of these 3 children that she was taking on, but somehow she learned so many things in this process and during this pandemic. And some of that had to do with something she had so strong inside, right? Something that she really just believed that things were going to get better and saw herself as a vehicle to be able to do that. She had an incredible spirit to make things work. When she was in some of her worst financial situations, she started selling things in her home, including her furniture, to help make ends meet, but still was positive, right? And still provided hope and instilled hope in the children, that she was the 3 teenagers and her own young child. The kids are currently thriving. They did a whole shift in their well-being in school, at home. Their whole physicality and demeanor has changed. So when they first came to live with her, you could visibly see how they had experienced some trauma, and now they're just much brighter. They have their posture is better, and it really is that energy that this relative who's caring for them supported and is giving them. So she would say things like, I'm going to try to find support even if no one's helping me financially. We're going to figure things out, and just had a positive attitude. That she also was one who accessed resources, so identified organizations like Family Focus that could partner with her, but really just believed that things were going to get better. Another, and as a result of that, she now has a license to be a foster parent to try to help other kids. She knows how to use and manage her computer. There's all these little silver linings and things that have happened in the past, or in this past year. But she certainly has something inside that I think really we can build on when we're working with families. We also find that families report, having a lot of reliance on faith, right? And that faith actually provides that source of hope and an opportunity that better days are going to be coming. And we often hear families talking about that as well.
Great, thank you. This is great insight into what's fueling that positivity in families. We also Natasha also talked about co-parenting and the power of your partner to help you get through this. Mariana, I'm going to turn it first to you. Can you share a little bit about how Family Focus is using this knowledge about the importance of co-parenting relationships to support families in general, but also through the pandemic?
Yeah, so one of our core areas is early childhood development. So we work with families that are very young, between the ages of 0 and 5. And for many of our families, they are actually, living with 2 parents, a 2-parent household, as some of the families that you all did in your study as well. And so we have always believed that, those 2 parents are critically important in any intervention or prevention service that we offer. So, an example of something that we've done and we continue to do, and related to fathers in particular, is that we encourage, when we first start with a family, so one of our programs is a home visiting program. And when we first start with those families, when we do an initial intake, we want to ensure that we're doing that alongside a cohabiting father, if there is one in the home. And so that might mean restructuring schedules, doing a home visit that's in the evening, or doing a home visit that's on a weekend, to ensure that not only we recognize and honor the role that a father has in that family and the children's development, but also we send a message, right, that we believe and we want to work with both parents. And even if we end up not being able to do a home visit at the time that father is always there, we have informed father, we're going to be sending you information that's specific for you. We think fathers are incredibly important in the development of their own children, but moreover, we even believe that when a father is active and engaged in the life of their child, that active engagement actually seeps out into community. So that father's role impacts their children, but it also impacts children in the broader community. So we certainly do promote that and want to encourage that throughout the programming that we deliver.
Great, thank you. And I'm sure that Natasha is really excited to hear that, because she, as many people know, specializes on fathers and believes strongly in the role of fathers for children's development, and a lot of research supports that. So thank you for sharing that. Now, Natasha, I'm going to come back to you to talk a little bit more about the implications of your findings for programs like Abriendo Puertas, Family Focus, and many others that serve Hispanic families. We see that promoting positivity and co-parenting relationships is important. What are other implications from your findings?
Great, thank you, Maria. It's so nice to hear Mariana and Adrian talk about the focus on positivity and co-parenting support. I think, you know, you're getting right at the core of what makes families stay strong and get through, you know, through difficult times. And the more we learn about how these processes work in these families, the better we are able to, you know, harvest and support those programs instead of, you know, not just paying lip service to them. So I really appreciate hearing about your programs. So I think a couple of implications of my work for this particular work that we did, that I just presented to you. I think we really wanted to make the point that the families are experiencing different types of stressors. This economic stress, you know, they lost a job, they can't pay the bills, is different from the social stressors that they felt around, you know, someone being sick, someone at work, or someone they knew, like you, both Mariana and Adrian are saying, when you feel close and loving to a family and that family member dies, or you can't be there during the last days of their life, it's very traumatic for families. And we need to acknowledge that those two things are separate and distinct, related, but they're separate. They have separate consequences in children and families, so they need to be treated differently. So our study shows that families are resilient, but again, you know, if we use this umbrella and the rain metaphor, if the rain turns into a storm, the umbrella cannot hold you up. I mean, so we want to be able to programs to support and strengthen these strengths already, you know, validate them, tell parents, you know, you're doing great, you are supporting one another, you're loving one another. I mean, the example that you gave, Mariana and Adrian, is lovely. I mean, we found the same thing too. One of our families was divorced. The parents were no longer a couple, but to make sure that the mom, she was about to lose her childcare place because she had to move. The dad took the child in, and they made all these arrangements, and they even arranged work schedule so they can be one day together just to talk about the child. So I think these are amazing stories that bear out in research that we need to honor and also validate. But as we all know, life will get tougher before it gets easier. So we really need to make sure that we provide not only more help, like the stimulus is doing, it's great, right? It's helping the economic part, but it's really not addressing the social piece. And we can't, you know, low-income families, like all of us, we suffer, we go through traumas, we need to address that. And this is important, that, you know, the resilience is in some, you know, it's consistent with the research that we find that it's good for some type of stressors. But again, if it's totally overwhelming, we need to acknowledge that. What's concerning to us is that if the social stressors are not attended to or addressed, they're going to impact the relationship with kids, right? The parents are doing the best to stay positive, to engage, but once these stressors overtake them, they're no longer playing as much as with the kids. They're no longer reading to them, and the routines are also upset. So when you have this very unpredictable environment at home, kids, you know, 2 and 3 year olds, they're having a hard time just understanding why can they go to childcare. So I think we really need to provide parents the support they need to process the loss, and more concretely, find appropriate high quality childcare. If you don't have a place for your child, it's on you to be able to find someone to take care of them if you go to work, and then that's another added stress. So I think, you know, acknowledging those two things is really important. And our research shows that we've done really well with one, well, kind of well, with one stress, the economic piece, but we have left the other one alone. So just a couple of implications for programs. Continue, you're doing amazing work with families. You're not only honoring and validating what they're doing, but also acknowledging that this is a good way to help them stay strong. I think the research is really fascinating. Some of the brain research shows that families who give support, it's also good for them, not just to receive it, but to give it. You know, you go down the street and you find your neighbor who needed soup or who needed whatever. That makes, you know, all these nice hormones in your brain start coming out. It makes you feel better and good and that you're doing something good. So I think, you know, the give and take, the support is really critical. As Maria said, or you guys alluded, you can teach people to be a little more optimistic. You can show the power of being a good, you know, staying in a good frame of mind. We have a lot of evidence actually from the health research that people who are positive, you know, they can fight off cancer and they are better physically prepared to deal with adversity. They adapt to situations better. They are problem solve quicker. So just keeping a positive mental health can be so amazingly. And it used to be that we thought it was such a flashy, you know, like a fluffy thing to do. Like, what is optimism? You got to show something more concrete, but it really is the key to mental health. So not just address your depression, but also your positivity. You know, begin to really support families, you know, to stay positive. And when children are positive, when moms and dads are positive, children are happy as well. You know, so I think, and the other point that I really want to emphasize is that the pandemic changed the life of everyone, parents and children were too little to tell us what happened. You know, one day they're going to see their favorite teacher and they love going to school. The next day is, you know, they can't do it anymore. And it's really difficult to explain to a child that the pandemic, we have lockdown. What is lockdown, mom? I mean, even older kids don't understand. So, and it's really difficult to parent a stressed out child. So the children were doing the best they can and the parents were doing the best they can. But really to understand that children are also out of sorts. You know, they're also trying to figure out and really support parents in their job that just became a little harder, right? If it's regularly hard to parent a child, it's a little more difficult to parent that child in hard times. So acknowledging that the whole system, the whole family was affected and provide support to each member. I think it's great what programs can do. Thank you.
Thank you. Thank you. We're going to open up now the floor for questions that you can add in the chat box. We already have some, so I'm going to read some that have come up. One is, do you think that the culture of warm and nurturing parenting during early childhood also sets people up to be resilient? I'm thinking of Bruce Perry's work. I guess you can all answer it from your perspective. Maybe Natasha can put the research perspective, and Mariana can say what they're seeing in their families.
Sure. I think we're all going to agree that yes, you know, it's nice to love people, right? I mean, you feel good that you're making some other person that, you know, adult feel better. I think definitely, you know, providing warm and supportive, you know, support for parents and the children, it's really it's beneficial for everyone. Parents, fathers, you know, we also go to people's homes and we asked to let us in and observe how they are parenting, and dads can get a big kick out of children and playing and just getting down on the floor and doing puzzles or whatever. I think those things definitely keep you in mind. But I'm always reminded that being a poor in America is really, really hard, so that, you know, this strength and this optimism is going to be tested in so many ways, so that we can't just say, okay, these families are great and that's it. I mean, these families are great and they're doing what they can, but we really need to provide ongoing support so they stay like that, because as we all know, children get older and we're older, problems just get bigger and worse. So I think just keeping the, you know, optimistic about the future, but also encouraging and supporting it along the way. You can just say, you know, the positive and that's it. We really need to nurture in our programs and policies as well.
And if I can jump in, I'm sorry.
No, go right ahead, Mariana.
If I can jump in, yes, Family Focus is an early childhood serving organization, and of course we love Dr. Perry's work. We certainly believe that there is an important opportunity when you have a family with very young children to begin to develop a foundation that can be very long lasting. And so our organization is built on these 9 principles of family support practice that really does all of that, right? Supports families to recognize that they are their child's first teachers. I think, recognizing that they can be resources for themselves, for their family, and for the community. I didn't get to talk about our Health Navigator program, but one of the things that we realized with the Health Navigator program is that those parents those participants that are health navigators are being leaders in their community, has developed strength within them, has developed increased resilience, they now see themselves as leaders in the community. And when our funding ended there, we asked, can you volunteer? About 85% of our promotoras said yes and continue to volunteer in community, increase their skill set, increase their knowledge base, and want to give back and see their role as critical in the development of their community. So I think when we're thinking about early childhood, there's just a very big opportunity to be able to set that foundation of positivity, develop resilience, being strength-based, that can go a really long way. And I think, another piece is when families were in trouble because of the pandemic, we got families that, came back to us after generations, right? So maybe their child that was in the program is now a parent and needed support. So that connection to community-based organizations and recognizing that it's concrete support in times of need, right? That's what we offer, and recognizing that there's opportunity to build that early on, that families can come back to it when they need it.
Plus to everything you said, Mariana, I love those points. And just to add a little bit about, when we're talking about, parent positivity and our really ability to shape our future, right, for ourselves, for our families, and our children, also means, as you spoke to, Mariana, is how we advocate, right, for our children, for ourselves, right? We know that during the pandemic, we saw so many families, right? In our survey, 63% of families, of Latino families, said they lost their health insurance, their employer health insurance during that time. And so not having access to healthcare, not having access to living wage, not having access to sick leave, all those things are public policies that impact families, right? And the ability for a parent and a family to say, yes, not only can I advocate for my child and for them to get the best education, the best early child care, the best parenting for me, but how can I advocate, how can I shape also and be involved in the public discourse about this social safety net, the safety net that we know that so many people needed during this time, and how can I be that advocate for my child, for my family, and for my community? And Mariana, you're absolutely right, is when we see parents lead and become leaders and advocate on these issues, that is what this really work is about. It's about that individual, that well-being at the individual level, but also that well-being as a community that we know that we're all fighting for so hard.
And it ties nicely to the research that Natasha was alluding to earlier about giving support makes you increases this sense of agency. So thank you for sharing that. We have another question that's, how did or do families cope with the uncertainties of the future? Like, when will COVID end? How have you had discussions about that with your families? If so, what kind of messages are you communicating? What are they saying?
Well, I'll just say briefly, and that it's real important that in our as we hear from families and hear this sort of public discourse about the pandemic and trying to get accurate information, I think it's real important for us to sift through a lot of the what's untrue and what's true, right? And to really lean on our public health professionals on real information, and making sure that we really elevate that information and try, as trusting organizations, right, that we all know that families, on the ground, they listen to their healthcare providers, they listen to the organizations like the ones we're representing here, like the ones that many of you audience members represent. They listen to us and they trust us, and it's real important that we get that accurate information and try to keep, as updated as possible, and sharing that with our with families and partners. I think that it's we all know that many of us are getting news from Facebook and from social media, and that sometimes that's not the most accurate, and it's just real important, I think, that now more than ever that we create these peer networks, these social networks where we convey real information about the situation that we're in now, and where the future might lie. I don't think any of us have a crystal ball and know where we're going to be. I know things are constantly changing, as kids come back to in-person education. There's different, the CDC just released a guideline, this week about certain mandates, at school, at schools, and so and in communities and local government. So I think all those things, we just need to keep an eye on and make sure that we're sharing good information.
Great.
I agree with everything that Adrian said, and the only thing that I'll add is one of the things that we've been really intentional about at Family Focus is to partner, or participate at tables that have a broad base of partnerships. There's one in particular called Illinois Unidos that we partner at, and there are elected officials, federally qualified health centers, direct providers, city governments, elected officials that are at the table coming together, looking at, getting the real research, having, pushing forward the policy and the approach that we need to ensure that Latinos are being considered in all aspects of the pandemic. And then also at the local level with our community partners. One of the things that we were able to do when the pandemic hit was we had to pivot the way we worked, and we were able to have had already these really strong partnerships that when we needed to respond to families in emergencies, we had a network of other nonprofits that were our partners that we could connect to answer and respond to all, the whole family's needs. And again, so I think just, ensuring that we have our ear to the ground with experts that have the correct information, sharing that, but then also utilizing those trusted leaders like promotoras de salud or community health ambassadors, et cetera, in the community, and making sure that they have the up-to-date information, because they're the ones that are in and out of community, right? They're at the grocery store, the lavanderia, they're, walking their neighborhood. So we want to ensure that it's a holistic and systemic approach.
I would just add quickly, I agree. I think that's exactly what parents are telling us. One thing that I didn't present today, so we asked our parents, where do you get your information about COVID? And a lot of the parents said television and neighbors. So this urgent need to provide accurate information, understanding the needs of the community. For example, in our study, we've called many families, and we have a list of services, referral services, if we think that the family may need them. Often the information is so overwhelming, the parents don't know to go to the computer and place a link and then sign in and all that. So we just made a phone call, and if the family said, I don't even know where the link is, we did it for them, and we just reach out to the person that needed them. So there are many families who are not, literacy skills are difficult for them in English and Spanish, and I think we just need to provide different ways of approaching those families, like a phone call. So many times we made a phone call too, and mom said, I just need diapers, like don't talk about it. So we send diapers, just something that could just make them feel like a diaper. You need a diaper today, not tomorrow. So I think knowing where the families are getting that information from, and where might be the sources that are not very accurate, and how to provide information to parents regardless of the skills, I think is very important. So I appreciate your efforts.
We have another question that's more research-based, Natasha. So your study examined positivity and co-parenting support as potential protective factors. What are other factors that researchers might want to look at in their work as they try to identify protective factors that can buffer some of the stressors of the pandemic?
Yeah, thank you for that question. That's a great question. I think that's exactly where I think we are on that research side, that we know that what things are promotive, like we know that, being a good parent is good. We know that, giving help to others and getting support, we know that all those things are good, promotive, but we don't know if they are enough of the umbrella to protect you against the harm, to continue with the metaphor, because I mean, sometimes the pain or the risk that parents are experiencing is so grave and so big that the umbrella is not a match for the adversity. So I think we need to figure out how much and what types of promotive factors can actually be protective so that we can strengthen them. Definitely, we just published a study looking at parenting and the very positive parent-child interaction between moms and children and dads and children. In fact, the father relationship with child is very promotive. It protects children from the stress of anxiety or parental depression that is sometimes very it's high in many low-income families, feeling that no matter what you're doing, you're not getting ahead, that all these problems are coming up. But that relationship, when it's positive and nurturing and reciprocal, seems to protect children, so they're not as affected by the negativity of having depression. It's also so important, as so many of us have said today, that even if the parents are not longer in a romantic relationship, that they continue to help each other as parents. And if they work as a team, the child feels good, that things are fine. But when mom and dad are fighting about childcare and who does this, and all these things related to children's anxiety also increases, and their behavior problems increase. So positivity in thinking, good, warm, loving, reciprocal parent-child interactions and co-parenting support have been just a few of the things that we think are protective factors, but we don't know how much of that and against which type of stressor. So we need to continue to do this work and work with programs so we can learn from each other and understand what is working for families and what's not. But thank you.
Thank you. So we only have 3 minutes left, so I'm going to ask one final question, and I think it's for Natasha, if you can answer it briefly. It's the attendees thanking you for bringing up the issue of childcare. The question is how we can help families who are worried about their children falling behind and not being ready for school. How can we help schools understand that development will occur with support and cannot be rushed, that our children need time to recover from the stress of the pandemic? It's a big question, I know, for a minute, but
that's a $5 million question if I come up with the answer. It's such an important question, though. I think, how do parents know that the kids are doing well? There is actually a really amazing program that I want to put a plug in here. As a colleague of mine had devised an intervention program, but what the program does is connects families and teachers in real time, so that the parent writes a question in a text and says, my son is having, how do I encourage him to read, or he's been distracted, and the teacher gets this message and the response in the language of the parent. So it's a real-time translation between the parent and the teacher. So I think increasing that communication in a way that is that it empowers a parent. Often than not, the parent the teacher in the school and the parent relationship is much more of, you're not doing this, you're not doing that, instead of teachers saying, okay, what are you doing that's working, and let's work together. I think that, I've heard so many Latino moms telling me, when I go to school, all they're telling me is that the kids are not doing right, but I don't know what I'm doing right. And so empowering parents that they can do many things that they're doing are right, but they need to communicate with teachers. And also, I know we have run out of time, but really running, for example, children. I have a couple of parents who have children with asthma. Just something as physical as that. Is it safe to send your child to school? So I think that the teacher and the parent relationship, and not just moms, but dads, to be included in the school communications is really important to make sure that both parent and teacher are in the same page regards to the child.
Thank you. Sorry that was rushed, but we got very great questions from the audience. I want to thank our funder at the Administration for Children and Families and the Office of Planning, Research, and Evaluation. I want to thank our panelists for sharing such great information, and of course our audience for participating. And please do email us if you have any information that you'd like to share with us or questions at info@hispanicresearchcenter.org. You can check out our website, hispanicresearchcenter.org, and also please follow us on Twitter. Thank you so much and have a great afternoon.
Thank you.